When it comes to smoking a cigarette, the harm is on the label, a harm that educator and father Baljit Renew is trying to put a stop to.
A major part is getting parents involved. We have at Clayton a number of parents who gave their kids vapes because they said it's not as harmful as smoking it.
When it comes to vaping, experts like Dr. Chris Carlston say the advertising is not as clear, even when the reality is.
And vaping is continuing to be a huge problem. The vaping rates amongst youth continue to increase.
And according to the Canadian Cancer Society, vaping among young people rose by 74% between 2017 and 2018. New regulations have been in the works to address this since last year, and BC's health and education ministers have come together to say COVID-19 delayed the implementation, but the wait can't go on.
If you are a young person, if you are under 19, it is not harm reduction, it is just harm. When people are addicted to nicotine, they are at the mercy of that nicotine, and we have to speak to that.
The sale of non-tobacco flavors will be in adult-only stores, as well as packaging will remain plain with health warnings on the labels. Now, Minister Dick says the nicotine level will drop down to 20 milligrams, which is the equivalent to 20 cigarettes. And new retailers will be required to comply immediately with the new rules, while existing retailers will have until September 15th to make the changes. For Stacey White, this could be another big hit to her business.
We are strictly vapor-related products, so it is going to have a very big impact on us because a large portion of our stock is going to become obsolete.
It's not a necessity. I have no issue if vape stores close down. You're providing a service to people that isn't required for life.
And White says she's all for protecting the kids, but she doesn't want to see the potential harm reduction avenue difficult to get to.
Because I do think that you need to make sure that you aren't harming access to people who really could have life-saving, life-changing experiences and benefits.
These new rules come after a series of respiratory illnesses connected to vaping were reported across North America. And as of April 7th, 19 cases of the illness had been identified in Canada, including 5 in BC. Zahra Prem, CBC News, North Vancouver.